Namaste, my dear brothers and sisters. Love and blessings of the Mother and Sri Aurobindo to all of you from Sri Aurobindo Ashram Delhi branch. To today's topic, it's about smoking, why people smoke, why they should not, and if they do, how they can quit. This is a topic on which I am highly qualified to speak because the number of cigarettes that I have smoked in my life is a grand zero. So it will be all theoretical, but I think so is much of the audience. I don't think much of the audience smokes either. But for those who might be smoking, if we come in contact with them, uh, how we can help them is what this session is about. So with that, now I go to the PowerPoint. So the title is The Why and Why Not of Smoking and How to Quit. Can be a little misleading. It doesn't mean why people smoke or why one should smoke and why one should not smoke. Uh, it can also mean why not smoke, hmm? Which means as if we should smoke. But what is implied is why people in general smoke, if they do, why they should not, and if they do, how to quit. It's a beautiful quote, anonymous, but all the same, I liked it. Cigarettes are killers that travel in packs. Now, let's see what smoking does to a person. Every time a person smokes, he exposes himself to a particulate matter concentration 500,000 times, 5 lakh times, higher than that in the most polluted city in the world. So much for about our efforts to fight pollution, atmospheric pollution. On one hand, we are trying to reduce that, and on the other, so many people smoke and voluntarily expose themselves to a particulate matter concentration which is much, much higher than in the most polluted city in the world. Apart from inhaling an extremely high density of particulate matter, the person also exposes himself to high levels of carbon monoxide, which is a poisonous gas. It is poisonous because it competes on a very unequal footing with oxygen for binding with hemoglobin. Unequal footing because uh, carbon monoxide and hemoglobin have an affinity for each other, which far exceeds that of oxygen and hemoglobin. So the result is quite a bit of the oxygen gets displaced and the hemoglobin available in the blood gets attached to carbon monoxide. So extremely small concentrations of carbon monoxide can also displace quite a bit of oxygen from the hemoglobin. So the amount of oxygen carried by the blood goes down. And if the concentration of carbon monoxide is high, as can happen, say, if a person sleeps with the burning coal in a room overnight, or if one starts a car in a closed garage, feeling it's very cold outside, let me start the car and uh, warm it up a bit. When the heating has become effective, then I'll drive out. Uh, the carbon monoxide from the exhaust might actually kill the person. So the person inhales not only high density of particulate matter and high levels of carbon monoxide, but also several chemicals known to increase the risk for cancer. And he exposes others to much of the above. And most exposed would be his family and friends, people with whom he spends time, people who are near and dear to him. They also get exposed to quite a bit of the above. May not be to the same extent, but enough to be dangerous and risky, and they carry the same sort of risks as he himself does. Everybody knows that smoking is injurious to health, but yet some people do smoke. And why do they do? The beginning is usually a result of one of these things in youth: the peer pressure. If others are smoking, why not I? And uh, sometimes the friends persuade the person to smoke. And if he does not, then they call him a baby. And therefore, he tries it. The first cigarette is not a pleasant experience. The person coughs and wonders why people uh, like this thing which is giving me cough and making me feel nauseated and so on and so forth. But then, if he complains about it, he may be called a sissy. So he tries another one. The tolerance develops rather quickly, and he starts enjoying the uh, more pleasurable aspects of smoking. So it may start as peer pressure and a tendency to conform in young age to do what others are doing, others in the same age group, others around us. And if he does not, he may be considered a weakling and that he doesn't want. And also, youth comes with an attitude of defiance, breaking rules, which in another way is good because unless we defy conventions, there will be no progress. Progress implies change, and therefore, this attitude of defiance can be positive and can be used in a healthy manner. But then, to break every rule is not what this defiance is the best way to use. So, prudence lies in also having the discretion to use the courage that the person has to defy conventions, to defy and break rules which have been laid down for him by others, and when not to do it. So that discretion is also a part of that prudence which a young person should develop. The sooner the better. Then there fortunately there are no more, but there used to be ads that make smoking smoking look very stylish. There was a series of ads under the banner "Made for Each Other," which were very common when I was a young boy. And this is one of those ads which doesn't exactly tell the person to smoke very carefully, it has been drafted. It just says made for each other, this boy and the girl, as if they have been made for each other. And then under at the bottom, it says filter and tobacco perfectly matched. So in Will's cigarettes, the filter and tobacco have also been perfectly matched. And then on the left hand side corner, you find in very small print the warning smoking is injurious to health. So the ad is technically safe in a way, but one can understand what influence it will have on young people. Now, here are some of the other reasons why people uh, smoke. The beginning we have seen how it happens, then why they continue with it. They get oral satisfaction from it. Uh, if we put anything in the mouth, it gives us some satisfaction, and this starts very early in life. And that's why for babies we use pacifiers, uh, and that can keep the baby quiet for quite some time. Although that's not the best way to keep the baby quiet. Um, Instead of giving time and attention, we sometimes depend upon these pacifiers, which are shaped like a nipple. Sometimes also release a little sweet juice in the mouth of the baby. But even if they don't, just the presence of something like a nipple in the mouth seems to keep the baby quiet and happy for some time. So this oral satisfaction is not confined only to children. It applies also to quite an extent to adults. Now, once an ad was designed based on this, uh, the child with a pacifier, and coming out of that pacifier is either a pipe or a cigarette. And and the implication of this was that don't be a baby, don't pray for oral satisfaction the way a baby does. You are a grown up, you are an adult. So better grow up and don't have that sort of a craving and don't try to satisfy it with a cigarette. So that was the implication of the person who designed the ad. But then people misunderstood it. Some people thought the ad is trying to tell us that smoking a cigarette or a pipe is as innocent as a pacifier. It's as harmless as a pacifier. So that's why you don't see those ads anymore because this ad can be easily misunderstood. Some people continue because they find it's easy to lose weight. They can eat very little, and instead of uh, having a meal, they just light a cigarette. Hmm. So it helps in losing weight. And here's a smart quote on that. Yes, smoking does help in losing weight, one lung at a time. Then the person continues because the person gets addicted. The person can't do without it. Uh, The person develops withdrawal symptoms if the person tries to stop. And that's what made Mark Twain quip with his usual sense of humor: "If I cannot smoke in heaven, then I shall not go." He was willing to give up being in heaven if he will not be allowed to smoke there. So intense is the addiction to smoking. And if the person does decide to quit, then he gets withdrawal symptoms, which might make him return to the cigarette. And uh, here are some of the symptoms which this picture shows: uh, headache, tiredness, irritability, sore throat, insomnia, difficulty to fall asleep. These are some of the symptoms that the person gets. And they are so annoying that the person may once again return to the cigarette. Now, what are the effects of smoking on the person? In more technical or serious terms, the effects are primarily because of three things: the addicting substance, that is nicotine, the effects of the smoke itself, and the effects of heat. So let's look at these one by one. The effects of nicotine. Nicotine does help improve the mood by relieving stress. It helps us overcome laziness, and it improves concentration, and therefore it may improve mental performance. But then it also paralyzes the cilia in the airways. Cilia, are small hair-like things which come out of the cells in the airways, the trachea and the bronchi and so on, the windpipe down. All these have on their inner lining small hair-like hairy things which are called cilia. Each cell has a number of cilia, and these cilia beat. That is, they keep moving. They move in such a way that they keep sending the unwanted matter along with the liquid collecting there, the mucus, upwards, upwards from the windpipe towards the mouth. And when it reaches the mouth, it gets swallowed. We don't realize it, but we are swallowing quite a bit of this dirt being brought up by the cilia up to the mouth. We are swallowing it all the time because in the stomach, it can't do any harm, whereas in the lungs, it would. So it's being sent to an area where it can't do any harm. So it's swallowed. But then the cilia get paralyzed with the result that all this mucus and the other unwanted particles keep collecting in the airways. Another thing that nicotine does is to constrict blood vessels. This would raise the blood pressure and can also precipitate a heart attack in a person who has a partial block. So, a person with a partial block of the coronary arteries, uh, if superimposed on that is the constriction of the coronary arteries induced by smoking, the person can get a heart attack. And that's how some people, you know, get a combination of factors which can constrict blood vessels, and that leads to a heart attack. Smoking can be one of those things, but apart from that, exposure to cold or a heated argument uh, and so on can also do it. But then you will talk more about it when we talk about heart disease. So, nicotine, by constricting the blood vessels, not only can raise the blood pressure, but can also sometimes precipitate a heart attack. Now, effects of smoke. Apart from nicotine, the chemical that addicts the person, that produces addiction, the person is also generating smoke while smoking. And it is the smoke which has the carbon monoxide, which we were talking about, which reduces the amount of oxygen carried by the blood because carbon monoxide competes uh, extremely effectively with oxygen for binding to the hemoglobin in the blood, which carries oxygen. So it reduces the oxygen carried by the blood. Then the particulate matter in the smoke, which we saw is much higher than in the most polluted city in the world. This particulate matter increases airway resistance, which means the ease with which air can flow through the airways that goes down. The flow of air becomes more difficult, and that makes breathing difficult and may lead to breathlessness. And then the chemicals in the smoke, apart from nicotine, there are several other chemicals, hundreds of other chemicals, many of which are known to increase the risk for getting cancer. Now, the effects of heat. The temperature of the smoke is about 1000 degrees centigrade, which is 10 times the temperature of boiling water. And the person is voluntarily exposing himself to this degree of heat, and heat itself can induce cancer. Any type of unusual stimulus applied repeatedly, be it a mechanical stimulus or a heat stimulus, to these surfaces, the type that we have in the mouth and in the other passages inside, that heat self itself can also induce cancer. So we can see that the effects of smoking on health are all injurious. All the effects are injurious, and the effect is cumulative, which means that uh, it's not that a cigarette produces an effect and then it is gone and the next one will start from a clean slate. The damage done by the previous cigarette continues to be there. The effect is cumulative, and therefore, the longer a person has been smoking, more are the effects seen. If that is so, then why do people smoke? One reason is that the pull is too strong. We saw it's one of the strongest addictions that a person can have. The second is the person knows that all these harmful effects are there, but there is that wishful thinking that somehow I will escape. It will not happen to me. And when we talk of lung cancer, that is also true because a majority of smokers do not die of lung cancer. But then, as we shall see in a moment, there are certain effects which no smoker can escape. So the person may escape cancer, but there are certain effects of smoking which no smoker can ever escape. So this wishful thinking that somehow I will escape is not really uh, based on any facts. It's not based on any solid foundation. But then this feeling that somehow I will escape is extremely common. And it applies not only to smokers, it also applies to people on the spiritual path. The spiritual path is a very demanding path. And by and large, we know what we should be doing. But when it comes to the sincerity with which what we should be doing is actually done, we very often find that that sincerity is lacking because of the uh, courage that it requires, because of the overcoming of temptations that it requires, and and therefore the person sort of uh, is not able to do sincerely everything that the person should be doing. But then, along with that, again, is that wishful thinking. Well, somehow probably I'll escape, but one does not in that case either. So the person cannot cheat himself. The person cannot cheat the divine. And the person may somehow console himself with this type of wishful thinking, I'll escape. The person does not. There are no exceptions. Divine justice is completely uh, merciless, or the economy of nature is harsh, as Sri Aurobindo has said. So it's a harsh economy we are dealing with, in which there is no escape. Uh, we have the free will to do what we want, but all the same, to somehow think that I'm doing quite a bit, this little bit of a uh, lapse or this little digression or regression or uh, lack of surrender or lack of sincerity, a little bit of it will not matter. Perhaps I will escape, does not apply. So smokers are not really an exception if they have this type of wishful thinking, but neither the smoker nor the person on the spiritual path really escapes. Now let's look at in terms of individual systems, the effect of smoking on health. We've already seen that in the heart and the blood vessels constrict, they become narrower. The oxygen carried by the blood is reduced because of the carbon monoxide, and the tendency for the clotting of blood is increased. And in a way, one can see all these three can have uh, d- important health implications. The constriction of the blood vessels would raise the blood pressure and also increase the possibility of precipitating a heart attack. The reduction in the amount of oxygen carried by the blood will have a compounding effect on the same, say as in case of precipitating a heart attack. On one hand, The flow of blood has stopped. On the other hand, whatever blood is flowing is carrying less oxygen. So that is a disastrous combination, and that is what can precipitate a heart attack. And on top of that, the tendency for clotting of the blood is increased, and therefore a clot may form, which in turn will block the blood flow completely. So all three put together are a sinister combination which can precipitate a heart attack. And when it comes to the tendency for clotting of the blood to be increased, it can happen with a single smoke, say during a party, where there may be also person may be exposed to cold, have heated arguments, and a heavy high fat meal. A single heavy high fat meal also increases the tendency for clotting of blood. So all these things put together can sometimes precipitate a heart attack while the person is attending the party or soon after he has returned home and just gone to bed. The person doesn't get up the next morning because of all these effects. The effects on the lungs. The mucus becomes sticky, and this sticky mucus is more difficult to move. On top of that, the cilia are paralyzed. Cilia, which are supposed to move it up towards the mouth, they are paralyzed. And the airway resistance is higher. So the sticky mucus, which tends to collect instead of being uh, swept upwards, further increases the difficulty in breathing. So all these things put together make it difficult to breathe. But then at night, what happens is the person is, and therefore the paralysis of the cilia starts recovering. They start working. And although the mucus is thick, sticky, and heavy, and full of the particulate matter which the smoke had, they do some job. They are able to do part of the work. They work very hard and bring some of it up to the airways and up to the throat. But then the poor cilia can't do in 6 or 7 hours of sleep uh, work which is much more than normal than they normally do in 24 hours. So on one hand, the workload is higher because of the sticky mucus and the particulate matter. On the other hand, they have to they are not working during the day because they are paralyzed because of the person smoking. So we can't expect the cilia to be able to do a very good job just in 6 to 7 hours when the workload is so heavy. The result is that some of this sticky material has been brought into the airways a little higher up, some in the throat, some in the mouth, and this irritates the throat, and the person starts coughing. So when he coughs at night, he coughs in the morning, uh, because that is when this mucus is being brought up. So the person has cough, and when he tries to clear his mouth in the morning, he brings out this white sputum, which is the muck that has collected overnight because of the cilia having done some work and brought it up to the mouth and the throat. So the person having this persistent cough and bringing out white sputum, particularly in the mornings, is what we call chronic bronchitis or the smoker's cough. Now, this is something which no smoker can escape. He may escape lung cancer, but chronic bronchitis, the person cannot escape. But then chronic bronchitis is not the end. It has further sequelae as time goes on, and if the person continues to smoke, what is it that it can lead to? Now, all the mucus has not been brought up by the cilia at night, and therefore some mucus gets collected in the lungs. It stays in the lungs and the airways, and it gets infected. Now, when this mucus gets infected, it's no longer white, it is yellow. And, and the person starts bringing out yellow sputum, and the person has an infection. And because of this, he may get fever and off and on frequent fever, and the person has now what we call bronchiectasis, which means the person is bringing out infected sputum. And because of this presence of this thick mucus in the airways start becoming wider. Wider, but doesn't mean the airflow is easier. They are wider because they have been stretched by this muck collecting there. So that is what bronchiectasis is. But then that's not the end of the story either. Uh, because the air is difficult, finding it difficult to move, and whenever a person has difficulty in breathing, it is more difficult to breathe out than to breathe in, because while breathing out, the pressure in the lungs is positive and that squeezes the airways. And through the squeezed airways, which are already blocked, it's more difficult to breathe out, and therefore the air starts getting trapped in the lungs. And therefore the chest starts becoming bigger. So the person has a big barrel shaped chest, but still it is finding it difficult to breathe. So the person has a big chest, but a useless chest. And this bloated chest, along with the explosive cough that the person starts having, it keeps having through the day and night, leads to a breakdown of the air sacs, because that then leads to a mechanical effect on the air sacs. On one hand, the chest has become wider, so everything in the lungs has been stretched out. The airways have become wider because of the muck that is collected. That's what happens in bronchiectasis. And on top of that, the person is generating very high pressures in the chest during the cough. And the result is there's a breakdown of the air sacs, which is the final region of the lungs where gas exchange takes place. They start breaking down. And this is what is called emphysema. So, chronic bronchitis leading to bronchiectasis, bronchiectasis leading to emphysema. This is a chain that nobody escapes, no smoker escapes, uh, provided the person smokes long enough and lives long enough. Now, here is a comparison of the x rays of a normal person and a person with emphysema. You can see that the person with emphysema has a bloated up chest, it's barrel shaped, and the area of the lungs is actually looking much more black. It's looking more black because the structure of the lungs, which is radio opaque, reduces that blackness. Here it is all air. So there's plenty of air which is not radiolucent, which is completely radio transparent. It lets the X rays pass, and therefore you get that black shadow. The bones are what are completely opaque, and therefore you get those white ribs. And the bones are white. The normal lungs are neither fully white nor fully black. They are black because the air lets the X rays pass, and the structure of the lungs does not let it pass fully, and therefore you have that grayish look. But in emphysema, that structure has broken down, therefore, much more of the X rays can pass, and therefore, it's more black. So, and that's the difference between the normal and the emphysematous chest as you see it on the X ray. Now, bronchiectasis plus emphysema then lead to chronic obstructive pulmonary disease because there's obstruction in the airways and it is chronic in nature. And this is what we call COPD or chronic obstructive pulmonary disease. But then that's also not the end of the story. Now, because the blood vessels of the lungs now offer more resistance to the blood flow because of the breakdown that has taken place, because the narrowing that takes place, and so on, the right ventricle, which pumps the blood into the lungs, has to work harder, and eventually it may lead to right heart failure. That is what we call cor pulmonale. That is, now the heart has also been affected, the right side of the heart. But then the right side of the heart and the left side of the heart are interconnected. So, anyways, this cascade nobody escapes, provided the smoker has smoked long enough and has lived long enough. So much for somehow I will escape. But again, that's not the end of the story. Since the two halves of the heart are intimately related, cor pulmonale, that is involvement of the right side of the heart, may lead also to left heart failure. Then we call it congestive heart failure. And the same patient also has a greater risk of having coronary artery disease, that is blockage of the coronary arteries due to fatty deposits there. And normally, a person with coronary artery disease with an advanced block may undergo bypass surgery and may benefit a lot from it. But this patient does not benefit even from bypass surgery much because the surgery bypasses only the arterial block in the heart. It does not do anything about the wrecked lungs. And the function of the heart and the lungs is interconnected, and therefore the person does not benefit much even from a bypass surgery. Now, this is a remarkable physician, Sir Richard Doll, who showed the power of statistics in a way, one might say. Purely on the basis of statistical data, which was very carefully analyzed, he demonstrated a very close association between smoking and lung cancer. This was a wake up call for the society as well as the medical profession. And uh, while an association does not prove a cause and effect relationship, the link was so strong that stimulated a lot of research and brought out the mechanisms by which smoking might increase the risk for cancer. But the fact that smoking increases the risk for cancer was initially shown as an association based on statistical data. And that was a remarkable piece of work for which Sir Richard Doll is widely remembered. Here's a book, Smoking Kills, about him. And here are two books by him, The Causes of Cancer and The Prevention of Cancer. When it comes to cancer, smoking increases the risk for not only cancer of the lungs, but also increases the risk for cancer of the food pipe, that's the esophagus, pancreas, the urinary bladder, and the kidney. So, normally the smoke follows the fire, but here the smoker's smoke leads to a fire in a way. And here is some startling statistics. To smoking may be attributed 80% of the deaths due to lung cancer, 80% of the cases of emphysema, 75% of the cases of coronary heart disease among the young who are otherwise at low risk for getting heart disease, 30% of all deaths due to cancer, 30% of all deaths due to coronary artery disease, and 20% of all cardiovascular diseases, including a very dreaded disease called Berger's disease. Berger's disease, is because of the constriction and poor blood flow through the legs. And this person develops uh, pain while walking. Eventually, he develops pain even when the person is at rest. Even the person is not walking, he has pain in the legs. And the blood flow may reduce then further to such an extent that the tissues of the leg start dying, and that is what we call gangrene. And dead tissue invites infection, and therefore, this gangrenous leg can get infected, and that can lead to infection throughout the body and multi-organ failure, and the person dies. And to prevent that, as soon as the person goes to the stage of gangrene, the only option left is to amputate the legs. So the person loses the legs to stay alive. So the wide variety of cardiovascular diseases, not just high blood pressure and heart disease, but also Berger's disease, which is closely associated with smoking. It's a disease which is exclusively, almost exclusively restricted to those who smoke. Berger's disease. I have been doing what a good doctor generally should not do, and that is to frighten uh, his patients. But I have not been frightening anybody of the disease that the person may have. I have been frightening the person about something which quite a few people do voluntarily in spite of knowing that it is harmful. Why a person should not frighten a patient who has a disease is because there, one of the most important things that the doctor should be doing is to give hope to the patient. Because that hope coming from a qualified person increases the confidence of the person in the self healing mechanisms of the body, and the person knows, I will get well. When the person starts feeling confident that I'll get well, his chances of getting well improve. And therefore, a good doctor gives hope, does not frighten the patient. But what I have been doing is frightening, but not against any specific disease, but against a practice which is voluntary, yet and harmful, and yet not too uncommon. So now let's see if a person gets adequately motivated by all this knowledge and wants to actually quit smoking. How is it that the person can quit? Quite often, the person has only a half hearted wish to quit. The person is not fully determined. There's a great deal of hesitation that goes with it. Apart from the fact that the person gets some momentary pleasure, a fleeting pleasure from it, The person finds the mental performance improves, and the person is afraid of the withdrawal symptoms. Apart from all this, uh, the person also knows somewhere that it is very difficult to quit smoking because smoking is one of the most powerful addictions. And the person also thinks that, well, I have been smoking for so long, the damage that I could do to my body is already done. So once the damage is already done, let me at least continue to enjoy what I enjoy doing, not realizing that the effect is cumulative and progressive. Um, but these are some of the two reasons why a person may hesitate to quit, and both have a grain of truth in them. But let's examine them a little more in detail. Giving up smoking is difficult. Once again, Mark Twain, with his uh, sense of humor, says, giving up smoking is the easiest thing in the world. I know because I've done it thousands of times. Hmm. So who says smoking is giving up smoking is difficult? Hmm? People like Mark Twain have done it thousands of times. So let's examine this first reason for hesitation to quit. That quitting smoking is very difficult. Yes, it is. But at the same time, the success rate is 20% at the first attempt. 20% of those who try are actually able to give up at the first attempt, another 5% at the second attempt, another 5% at the third attempt, and another 10% after more than three attempts. Which means that even after more than three attempts, only 40% of those who decide to quit are actually able to quit. So the success rate is low, less than half. May at the most about half of those who decide to quit are able to quit even after trying several times. But then it's a question of looking at a glass as half full or half empty. Why should a person assume that he belongs to those 60% who fail? He might as well belong to the 40% who succeed. And the difference lies in his own motivation. So if he's determined, he can make sure that he is one of those 40% who succeed, maybe after more than three attempts. So it is difficult, but it is not impossible. The second reason why people hesitate is the damage is already done. But then the damage that has been already done can be reversed. The risk for lung cancer is the same as that of a non smoker 10 years after quitting. So if a person quits, has been smoking for a long time, but then quits today, then after 10 years, his risk for lung cancer will be the same as that of a non smoker. So the damage would have been undone within those 10 years. And during those 10 years, the risk will gradually keep dropping. And something similar applies to heart disease. The risk for coronary heart disease is the same as that of a non smoker 15 years after quitting. Well, you might say, well, that might be true, but then 10 or 15 years is a long time to wait. And therefore, the damage is already done. That, in fact, is true. And you are just trying to encourage me by giving me this hope about what will happen 10 years later or 15 years later. Huh? But then there are certain types of positive effects of quitting which are much faster. The person's blood pressure goes up due to smoking and returns to normal within 20 minutes of stopping smoking. So the effects of the cigarette are gone within 20 minutes. So blood pressure returns to normal in 20 minutes. Carbon monoxide levels drop to normal in 8 hours. After the person has not smoked, within 8 hours, carbon monoxide levels drop to normal. The possibility of a heart attack precipitating a heart attack goes down within 24 hours. And food tastes and smells much better within 48 hours. So there are certain things which happen immediately. So there's very quick gratification available if the person decides to quit. Most important is to have a strong will, and for that, the person has to be mentally prepared to quit. Two methods by which a person might quit. One of them is to just decide one fine day, some auspicious day, that the person has decided from this day onwards, I will not smoke. The second method is a gradual method over several days. That is, I'll reduce gradually the number of cigarettes smoked per day and finally bring it down to zero. So these are the two methods, as one can imagine, even using common sense. Now, if a person had decided to quit smoking in one go, like, a quick surgical cut on one final day, then there may be withdrawal symptoms like irritability, restlessness, headache, insomnia, etc. Uh, for that, one of the solutions is to use a nicotine patch or a gum. Nicotine patch, is a bit like an band-aid. It sticks to the skin and delivers small amounts of nicotine uh, in small doses throughout the day. Um, so the person gets the nicotine to which the person is actually addicted, but takes away the effects of the smoke and the heat. The nicotine gum is something like chewing gum that again delivers, if it is chewed in the mouth, it delivers a small amount of nicotine which is absorbed. And from nicotine patch, it is this absorption is through the skin. In case of the nicotine gum, the absorption of nicotine is through the mouth. And the person may use these to reduce the withdrawal symptoms, but then the amount of these nicotine patches or gums used should keep getting progressively smaller, so that the person does not get addicted to these instead of the cigarette. The addiction will go only if the dose of nicotine is reduced gradually, and that is important. The person may also use relaxation techniques, and in the best relaxation techniques are available in yoga in the form of meditation and shavasana, etc., and relaxing pranayamas like alternate nostril breathing and Brahmari. So, person can use relaxation techniques to feel more relaxed. So, this is if the person has decided to quit suddenly, quickly, on one fine day. If the person has decided to quit gradually, then the cigarette to give up should not be the first cigarette of the day, because that is the most difficult to give up. So the person can start with the first cigarette of the day at the usual time, but after that, increase the interval between that and the next one, and keep a record of the total of the time at which the person smoked and the total number smoked in the day. One should also avoid situations in which one might smoke, like, say, being in a party where others are smoking, or getting into a stressful situation and then finding the excuse in that stress to smoke. So, one should avoid situations in which one might smoke. Then, the ashtrays can be tempting. They may remind the person of smoking. So, remove all ashtrays from the home and office. And instead of buying a whole pack of cigarettes, one can buy only one or two cigarettes at a time. Now, no matter which method the person chooses, whether it is the sudden method or the gradual method, the person should announce his decision to quit to family and friends. This helps because then the person may get some encouragement from the family, support from the family and friends, and the friends who normally persuade him to smoke will not try to do so if they are truly friends. So he should announce the decision to family and friends. And most important, if the person has made this announcement, the person is uh, more likely to stick to this decision, because the person will otherwise feel embarrassed. He lose face in front of family and friends. You had said you will quit, and now you're still smoking. So, that makes the person feel embarrassed. So, announce the decision to family and friends. Secondly, do not be disheartened by failure, because we have seen that only 20% succeed at the first attempt and many more after further attempts. So, one failure should not dishearten the person. Also, the person should not be frustrated by a single lapse. Suppose the person had not smoked for 6 months, and then one day, somehow, he gets into a situation that he feels tempted to light a cigarette. Oh, my 6 months record has been spoiled already. All my record has been spoiled, so now I can continue smoking. One lapse is not does not mean that the person's attempt to quit has failed. So one should not be frustrated by a lapse. So what one needs is a combination of the strong will to start the process, and optimism that even if I have failed this time, or even if there has been an occasional lapse, the future can be much better. I can quit. So that optimism, along with that strong will, which has to be uh, maintained, is what is required. And if necessary, the person can seek professional help from a psychologist or a psychiatrist who can help the person further in quitting. Jane Honest, the famous cardiologist, says quitting smoking is a process, it's not an event. And it's a process in that a person like Dean Ornish, when he's talking about it, he's talking about the process of getting into yoga in the most comprehensive way. So, coming to yoga, let's see why people smoke. Some of the important reasons are to beat stress, to improve mental performance. Yoga does both these things and a lot more. It helps us beat stress. In fact, does something more positive. It helps us fill life with peace, joy, and fulfillment so that there's no room for stress. Stress is eliminated rather than just relieved. And it helps us improve mental performance by improving our ability to concentrate and by putting our intellect more and more in touch with that higher power, which is makes mental performance possible at all. You know, it's not about thinking, but being in contact with the one because of whom we can think. And when you are in that with that contact, when that contact is established, then the mental performance is the result of what comes from that higher source and just flows through us, through our intellect, which acts as an unobstructed channel for that force. So the mental performance can improves also through yoga. And it does a lot more to make life meaningful for us and useful for those around us. So become happier and we radiate happiness. We become more loving and we radiate love. So, all the side effects of yoga, apart from beating stress and improving mental performance, are highly positive. And therefore, what yoga does is to make the very reasons for smoking disappear from the person's life. And when those reasons disappear, then the person is more motivated to quit. And that's how yoga helps also the person who wants to quit smoking. And also, yoga helps many people not to turn to smoking or to any other such fleeting pleasure for the sake of just getting a momentary relief from stress or a little improvement in performance by overcoming lethargy or any such thing. A person who used to smoke but does not smoke anymore, that's an ex smoker, deserves a great deal of respect. Because a person like me who has never smoked can stay away from smoking very easily. Because, especially when a person is on the path of yoga, one does not need, as we saw, the reasons for which people smoke or drink. Those reasons don't exist, and therefore it's easy to stay away from these things. But a person who has smoked and has gone through that process of addiction and has been addicted to something which is extremely addicting. So addiction to smoking is perhaps one of the most difficult addictions to overcome. And therefore, if a person has been able to achieve that, if a person has been able to overcome that addiction to smoking, he deserves a great deal of respect, more respect than a person than a person who has never smoked. Now, does smoking have any additional implications for women? Sometimes women turn to smoking purely to show that we are no less than men. You know, it's one of those unhealthy expressions of feminism. Uh, but then it does have, apart from all the implications of smoking that we have talked about, which apply to everybody, there are some additional implications for women. A woman uh, who smokes runs a higher risk for infertility, getting menopause rather early, and if she's pregnant, having a miscarriage, or giving birth to a stillborn baby, or the baby dying very early in life during infancy. And also, there is a greater risk for the child having birth defects such as cleft lip and cleft palate, which are very obvious, and also congenital impairment of cognitive faculties like memory and other intellectual functions, uh, which are not so obvious. The person will not know this impairment of mental function in the baby very clearly and easily, because whatever functions the person has as the child has when it's as it is growing up, we'll feel that this child is born like that. But the child could have had a much better mental performance if its mother had not been, his or her mother had not been smoking. So women uh, have some the implications of smoking are more for women than for men. That applies also to drinking. The tolerance to alcohol is about 50% that of men. So a permissible level for a woman is half that for a man. These are some biological differences that are built in. And of course, only women get pregnant, and that's why these additional implications for women when it comes to smoking. What are the ill effects of passive smoking? That's a person who does not smoke, but near whom somebody else is smoking. Essentially, the same as those of uh, same effects which the smoker has, maybe to a less extent, but the effects remain the same. Even because of passive smoking, the person runs a higher risk for coughs and colds, bronchial asthma, bronchitis, and pneumonia. And one of the risks is that the child may pick up the habit of smoking. Uh, I was once counseling a lady who was complaining about her husband smoking, and she said her, I think, 3 or 4 year old child, just picks up the something and then just like this and tries to blow the way the father does. So the son has started copying the father at the age of 3 as if something very normal and enjoyable. What are electronic cigarettes? These are relatively a recent phenomenon, and the first one was marketed about 20 years ago. The components of the electronic cigarette are that it contains a container, which may be called a cartridge or something, which has a liquid, and dissolved in that liquid, apart from other things, is a small amount of nicotine. It also has a heating element, small, tiny little heating element, which can heat this liquid enough for it to turn into vapors, and a battery to power this heating element. So there are ways of turning this battery on so that I'm turning the heating element on using the battery, and then the liquid forms vapors, you know, small fine droplets which can be seen like smoke, but are not as hot as smoke. And it has nicotine, and the person can get this nicotine. So the person still gets the same effects as those of nicotine without the smoke and without the heat. What are the uses of these electronic cigarettes? They may be used as a step towards quitting. That is, the person had decided to quit, but finding it very difficult because of the withdrawal symptoms, and therefore the person wants a supply of nicotine. It can come from a nicotine patch or a nicotine gum also, but this is one of the more trendy and fancy ways of getting the nicotine. Uh, some people use it as a less harmful substitute for smoking. They have not decided to quit, but all the same, they use the electronic cigarette, which can be put like an ordinary cigarette in the mouth, uh, and you can see some sort of vapors coming out like the smoke from a cigarette. So the outer sort of feeling is similar, but it's a less harmful substitute. Some people use it to get around laws. For example, someplace smoking may not be permitted. I'm not smoking. The person can use an electronic cigarette and say, I'm not smoking. This is not a cigarette. It's neither a cigarette nor a pipe or nor a cigar. So you can try to use it to get around those laws. And it is also being used as a status symbol to belong to a certain class. And the practice sometimes called not smoking but vaping. Vaping, VAP comes from vapor. So you're using a device which creates vapors, not smoke. So it's not smoking, it is vaping. And there are vaping communities building up, which are rather classy in nature. So it's a status turning into some sort of a status symbol. What is nicotine replacement therapy? The person has decided to quit but is getting withdrawal symptoms. So we replace only the nicotine without the heat and the smoke, and then gradually reduce the dose of this nicotine delivered so that the person can eventually quit. And it, various things apart from electronic cigarettes, which can give this, are the nicotine patch, which delivers nicotine through the skin, nicotine gum through the mouth, nicotine lozenges again through the mouth, and nicotine inhalers through the nose. So nicotine can be delivered through other alternative routes without smoking. Does this nicotine replacement therapy really work? Even if the person has decided to quit and is not using these only as a substitute for smoking, wants to quit smoking altogether. Actually, the success rate is not very high. Only about 20% of those who stay away from smoking for 1 year, uh, only about 20% stay away from smoking 1 year after starting nicotine replacement therapy. So, those who try to use these less harmful substitutes for smoking as an alternative to smoking eventually return to smoking itself. 80% of them return to smoking itself and are not satisfied with these substitutes. So, in that sense, nicotine replacement therapy does not work. It helps uh, quit smoking only about 20% of those who use it even as a substitute for smoking. They don't find it pleasurable enough, and eventually they return to smoking itself. Finally, end with this quote: a cigarette is the only consumer product which, when used as directed, kills its consumer. Consumer products come with instruction manuals which tell us how to use the product. The cigarette, even used as directed by the manufacturer, actually kills the consumer. Again, it's an anonymous quote, but it's beautiful. A cigarette is the only consumer product which, when used as directed, kills its consumer. And this material was largely based on this book, Back to Health Through Yoga, chapter 4. This chapter, which goes on to about 30 pages. Apart from smoking, this chapter also talks about tea, coffee, and alcohol. And this is an inside view of the meditation hall of Sri Aurobindo Ashram Delhi branch. And you are all welcome here. Questions and comments are welcome after the session and anytime later through email on yes@yesspirituality.com. Gratitude to the Mother and Sri Aurobindo for making these sessions possible. And thank you all for being there.
We can end with a moment of silence. Thank you, everyone.